My name is Gina Addy McKelvey, and I'm a nurse practitioner in the endocrinology department at Prisma Health. So I grew up in West Columbia, so this is home for me, and I attended the University of South Carolina School of Nursing for my undergrad and my graduate degrees. So endocrinology really involves the endocrine glands of the body. And for me, especially, my area of expertise is diabetes management. So if you are coming to see me in the practice, most likely it's because you are living with diabetes. I have a strong interest in diabetes. I've been living with type 1 myself for 45 years. And so it's something that I feel like is a way for me to give back to that community that I'm a member of. And I just have a passion for people living with diabetes and dealing with the burden of that, from day to day. I want to be able to help manage, help meet you where you are in that process, and help you along the way. I think for me, the first thing that I like to do when I meet a patient right off the bat is learn more about them and find out where they are in their process. Because honestly, if I'm trying to educate you about something, but there's something else that's weighing on you, I need to start there first. So I need to figure out where is our starting point and go from there. It's always survival skills first, making sure that you're safe. And then I'm a huge fan of technology for diabetes management. So I really do like to have those conversations and talk about how can that relieve some of that cognitive burden. Living with diabetes is like having a bee buzzing in your head constantly because you're making so many decisions. And so using technology can really help with relieving some of that burden. So some of the technology that we have access to now with diabetes management are insulin pumps and continuous glucose monitors. And the great thing about the systems available now is those are integrated together, meaning that depending on where that glucose level is with that continuous glucose monitor, that actually will lead to automated insulin delivery through that insulin pump. So if your glucose is going up, you'll get a little more insulin in the background. If it's going down, it will totally suspend the insulin through the insulin pump for a period of time. And, compared to where the technology was when I was first diagnosed 45 years ago, it's just amazing to me how far we've come in that 45 years. Outside of work, I enjoy spending time with my 2 adult children, and they're both married, no grandkids yet, but we love getting together, especially on the weekends, and just hanging out, having a meal together, and just enjoying each other's company. I'm a huge cat person, so I have 3 cats at home. They're my babies, my fur babies. I love to read just about anything. I love to walk. I love nature. So those are my favorite things to do outside of work. To make an appointment at our clinic, please call the number on the screen.